Hey guys, it's Dr. Ozempa, and I wanted to talk today about measuring and monitoring ketone levels. I get this question a lot, and it's pretty much something that I go over with every patient who I put on the ketogenic diet. Um, the first question always is, do we need to monitor ketone levels? And I think for the majority of people, doing some monitoring is going to be helpful for at least, the beginning stages of the diet. Some folks, maybe if you're doing it for weight loss, if there's time constraints or financial constraints to doing the testing, then, it may not be feasible for everyone. But I think at the very least for the first 2 weeks, most people can do the urine ketone testing, the keto sticks. They're super cheap. You can get them on Amazon. And that's a reliable way in the beginning part to know if you're in ketosis. Again, up until about the 2 week mark. Now, I'd rather see people doing blood testing because the blood meters are much more accurate. So the Precision Extra and the Keto Mojo would be the blood testing meters. And I'd rather see somebody really ideally start with that in the beginning. But like I said, the other way, if we're really trying to kind of work within a budget sometimes, is to start with the keto sticks for the first 2 weeks and then switch over to blood testing. But then the question always is really, how long does somebody need to do blood testing? So, the blood work is helpful because it lets you know specifically if you're in nutritional ketosis or not. And again, the definition of nutritional ketosis is very specific, and it's, being at 0.5 millimoles per liter or higher of blood ketone levels, and that's blood beta hydroxybutyrate. So that's pretty clear cut. And initially, it's helpful to know if somebody's in ketosis because the advantages that we're talking about in the ketogenic diet require that you be in ketosis. I know, big surprise, but so I don't like guessing about that initially. But then the problem is if somebody's got a medical indication for the ketogenic diet and they need to be on it long term, people don't like to prick their finger 3 or 4 times a day for years and years on end. Of course, many diabetics do this, but it's difficult and it's costly. So is there a better way? And I think there is for most people. Now, the small fraction of people will need to do blood ketone testing in the long term. They'll need to be doing that for quite a while. Again, that's a fraction of the people who are on the ketogenic diet. For the rest of people, what I usually do is this, is we do some blood ketone testing for the first month, ideally. And then we bring in something like a breath ketone analyzer. Ketonix is the brand that I like. It measures the ketone levels in the breath, essentially, and allows you to then correlate that with the blood. So over time, you're going to notice that where you show up on the breath testing is going to show up with a certain blood level. And once people are able to correlate that, and it usually takes a few weeks to do that, then, again, for most people, I'm okay with taking away the blood testing and then just using the breath analyzer. And you can use that thing. It's nice because you can use it 10, 20 times a day if you want. It's non-invasive, it's quick, it's easy, you can do it anywhere. So it's a really nice portable tool to know if you're in ketosis or not. And again, when we correlate things with blood, we can know pretty specifically where in that ketogenic range we are. For some people, it's about just being in ketosis. For other people, it's about having their ketones in a certain range. For that group, it may be helpful to continue to do the blood testing. Maybe not as frequently, maybe not multiple times a day, but once a day or every other day or something like that, just to make sure they're staying in the range they need to stay in. So again, there's a lot of different ways to do this with the ketogenic diet, but this is the way that I found for my patients and have gotten feedback from a lot of people that this has been helpful, and I hope it's been helpful for you too. So have a great day. Bye-bye.